Good afternoon. Thank you for joining us today. We will get started in 1 second. Oh, okay. Welcome to everyone. Thank you for joining us today. My name is Amira Bilal. I'm Vice President of Programs and Policy here at Caregiver Action Network. I'm pleased to be on this session of our Benchmarks of Care webinar, When Caring Hurts, Managing the Emotional Rollercoaster of Caregiving. The format of today's webinar will be a discussion, and I'm pleased to introduce my colleagues and our special speaker for today. First, let me provide you with an overview of Caregiver Action Network. Caregiver Action Network is the nation's leading family caregiver organization. We work to improve the quality of life of tens of millions of family caregivers. These Americans care for loved ones with chronic conditions, disabilities, or diseases. Caregiver Action Network also supports those meeting the living needs of older adults. We serve a broad spectrum of family caregivers. This includes parents of children with significant health needs. It also includes families and friends of wounded soldiers, from a young couple dealing with the diagnosis of MS to adult children caring for parents with Alzheimer's disease. We are a nonprofit organization providing education, peer support, and resources to family caregivers across the country free of charge. As I mentioned, the format of this discussion or this webinar today will be a discussion, and I'm pleased to introduce our special speaker for today. Ms. Nia McCray-Brown comes to us from Mental Health America. She serves as Director of Community Engagement and Partnerships at Mental Health America's national office. Mental Health America advances the mental health and well-being of all people living in the United States through public education, research, advocacy, and policy, as well as direct service. NIA leads the development of MHA's outreach initiatives and partnership opportunities to promote mental wellness for all across the nation. NIA is a licensed professional counselor in the state of Virginia and previously worked as a director of community mental health in a nonprofit to support other clinicians serving those with other mental health conditions. She holds a Bachelor's of Science in Psychology from Hampton University and a Master of Education in Mental Health Counseling from the College of William and Mary. Her passion for mental wellness initiatives is driven by her experiences in the mental health field and her understanding of how our collective mental health impacts our society. At this time, I would also like to turn this over to my colleague, Ms. Nicole Goebel, who serves as Director of Community Initiatives for the Caregiver Action Network. Nicole will masterfully navigate this discussion, and we welcome Naya and Nicole to today's Benchmarks of Care webinar. Thank you.
Thank you so much, Mira. Yes, so welcome to this Benchmarks of Care presentation. And today we're focusing in on the topic around mental health and mental health, particularly as it relates to balancing work and caregiving. We know that mental health can be impacted by our role as a caregiver, but there's also impacts of work when it comes to mental health. And so we really want to look at that intersection and have some conversation about what we can do to help manage some of those issues and what resources may be out there. So, uh, I guess to kick things off, one of the things that makes this a little bit more of a challenge is the fact that, well, caregiving doesn't stay at home. It's important for us to understand, yes, caregiving does impact our mental health, but when it comes to work, caregiving just doesn't stay at home. You'll often hear us saying things like, caregiving on the clock, caregiving doesn't happen when you're off of your work shift. It happens all the time. And how can this play into the workplace? Well, it can lead to difficulties focusing on your work. Maybe it's focusing in on those long meetings or focusing in on tasks. It can make it really difficult when your attention is being divided. It can be guilt, having to leave home to go and work and have either additional family members, friends, or in-home care or support your loved one while you're at work. And then there's just the burnout. Again, we often talk about caregiving and full-time job being essentially two full-time jobs. And if you're working part-time or shift, it really is the same thing. Caregiving is a full-time job, whether you're a long distance caregiver, a primary caregiver, whatever that situation may be, it can definitely take a toll. And that burnout can lead to, uh, can have some impact on that attendance and performance at work. So, really wanted to lay that out as, why caregiving and work conversations are really important to have together there. Next slide. So, how does caregiving show up at work? Well, we talked about some of the impacts, but let's talk about some of the real, I think, numbers here. 70% of working age caregivers are employed, whether it be full time, part time, or uh, via hourly shift, while they're providing care. There's 1 in 2 working caregivers report going in late, leaving early, or taking time off. The workday, it can, again, be those distractions when you are trying to have meetings, um, the guilt, the irritability, just feeling like you're being kind of cut into so many different pieces. That can really take its toll. So that's how caregiving can show up at the workplace. Next slide. I think that one of the things that's also really important to frame in terms of a conversation around mental health is that we have the numbers to support the impact here. There's about 7 average in a 30-day period of poor mental health days that caregivers report. We have 38% of caregivers report high emotional stress from caregiving, and 23% say caregiving makes it difficult to take care of their own health. And it boils down to one thing: mental health support is part of sustaining both care at home and performance at work. This is a key feature when we talk about the importance of self care and taking care of yourself. It is physical, mental, and emotional. And we want to make sure that we're highlighting the importance of that mental health component here. Next slide. One of the things that can also add a complication is that some of the complex emotions that can be part of caregiving may feel isolating to us, but they're normal and they are work relevant. Caregivers can feel many things at once. We can feel guilty, we can feel angry, we can feel resentment that maybe we're not able to do X, Y, or Z, or that we've had to make a change in maybe our career course or plan due to our caregiving responsibilities. We can feel grief and relief. All of these can happen separately and together. So, a question I want to put out for folks here in the chat: what emotion is hardest for working caregivers to name out loud? And think of yourself. Put yourself in that working caregiver role. What emotion is hardest for you to name or to talk about? I know I'm putting some folks here on the spot, but share in the chat kind of your perspective. We always love to have that insight. Um, so let's talk about some of the impacts here. Burnout lowers that emotional bandwidth. I don't know about you, but when I am very, very stressed, whether it's a really busy time at work, or other different things, um, your bandwidth, your emotional bandwidth, gets a little bit diminished. I also think about it like when you're not feeling well, you can feel irritable. You're not feeling well, so you may feel short. You may be angrier about certain things. And so think about that bandwidth. Emotions can peer in directly. So we may be feeling an emotion, a specific emotion, but it may look differently with how it's being displayed. So withdrawal, distraction, decision fatigue. I know that certainly has been something that when I've been chatting with caregivers has popped up. Just that absolute exhaustion when it comes to making decisions, and that can certainly have an impact at work. And I think that one of the things that we've learned is that support starts with recognition. Naming yourself as a caregiver, finding other caregivers, being able to tap in to resources at work via HR to help you navigate with practical options at work so you can manage some of these impacts. Next slide. So I want to put us into an example here. Let's paint a picture with our minds. As an old professor of mine used to say, a caregiver receives a clinic call about their parents' medication while preparing for a client meeting. This has happened probably to many of us, right? We're in the middle of our workday. Maybe we're prepping for a presentation. Maybe we are getting ready to, we could be on a work trip. This actually happened to me last year. I was actually out of state at a conference, and I got a call that my mom was in the hospital. So when we get that call, when we're on the clock, um, we have to figure out what we can do. So let's tap into this example of getting that call right before a meeting about a change in parents' medication. So what are some things that a caregiver may be wrestling with? Well, there could be anxiety about an upcoming appointment, um, guilt about not being present to figure out like what do I need to do? How can I make sure that this is the right medication? Ask questions. And frustration that maybe my workday has been a little bit interrupted. Maybe there was something I needed to tackle right before this meeting, and now I'm on the phone and trying to juggle lots of different things. So, again, this is where all of those complexities of those emotions are coming in and kind of converging all at once, and that can be really difficult. So, what does support then translate into? What can support look like at the workplace? Well, it can look like taking a little bit of a break. Take the 5 minutes, confirm what's urgent and what needs to move today. What do you need to do? Prioritize. Think about the most urgent thing and make that the go, and then let the others come after. That can be really hard. Decision fatigue, we just talked about. But that can be a key to kind of eliminating some of that pressure and that stress in that moment so that you can say, okay, I've got the information that I need about this change in medication. I know what I need to do next. So now I'm going to switch gears. I'm going to get ready for this meeting. And when I get home tonight, I'll talk through with my loved one and say, okay, this is what's happened. This is the new medication that we're on. And go through that. Make sure that they're comfortable. Make sure that they don't have any questions, and then say, okay, well, now we can follow up with the doctor. We have a list of questions. Let's get that sent in an email. The goal is not to leave the caregiving at home, but it's how to manage those moments and reset and figure out what that next step is with that support that you have available. Next slide. All right. So the heart of today is I want to have a conversation with Naya from Mental Health America. Mental Health America has been such an amazing CAN partner, certainly since as long as I've been part of CAN. One of the earliest, I think, kind of team meetings I was a part of included Mental Health America, one of just our amazing partners in a lot of different ways. And they've been doing a lot of great work about how to navigate some of these mental health issues in the workplace. And so, Naya, I'm so glad that you could join us for a conversation. And I think we may go ahead and turn off the share screen just for now so that we can see each other and have a conversation. So thank you so much for joining.
Of course. Thank you for having me. And thank you to everyone in the community that's been joining and chatting and for all of the incredible contributions you all provide for your family and your community. I'm just so grateful. If no one's told everybody on this call, thank you for today. Thank you. Appreciate you so much.
Yes. Naya, I guess one of the places I want to start um, is tell us a little bit about the work that you do at Mental Health America in supporting folks in the workplace and caregivers.
Absolutely, absolutely. So, Mental Health America is the nation's longest standing mental health advocacy organization. And so we've been around since the early 1900s, providing mental health support and destigmatizing mental health stories for folks across the country. It's so important to understand that the fact that caregiving and mental health really do intersect in so many different ways. And we always say at MHA, like 1 in 5 people will experience a mental health condition in their lifetime, but 5 in 5 people are managing their mental health every single day. And so that includes caregivers, that includes these different populations, folks who live in specific places. And at MHA, it's really a priority for us to be at every single intersection of mental health. And there's a lot of intersections there. There is no health, if we really think about it, without mental health. And so to understand the impact of our mind and mental health on our well-being is so, so important. There was a post earlier where we shared a few of MHA's caregiving resources. And my role at MHA, especially being a previous therapist, is to be able to support the development of those resources from a clinical perspective to make sure that all of the things that we create are informed by real experiences of folks who have experienced both whatever identity we're speaking about. So today that's caregiving and the mental health perspective as well. I also work in community engagement and outreach, so I'm always doing different pop-ups in different towns to be able to connect one-to-one with folks and hear those stories firsthand so that they can inform our work. I also work really closely with our workplace wellness team to be able to understand and sort of allow the influence of the workplace to inform the work that we create for caregivers and all of the different populations that we serve. So, so excited to be here to share more today.
Great. Thank you so much, Naya. And like I said, we've been so pleased to be able to partner with MHA in so many different ways over the years,
Yeah.
and it's always a treat to have you um, as part of these conversations. I guess one of the questions I'll ask is, so we've talked a lot about some of the, I guess, mental health um, red flags that can pop up at work, some of those challenges. But one of the issues is how does someone recognize
Yeah.
that maybe they're getting to a place where their mental health is being impacted by this balancing act?
Absolutely, absolutely. It's a really important question. I love, and I kind of giggled a little bit when you said red flags because that's exactly what your body and mind and the systems that exist within us are trying to communicate is their signs. And just like we have, road signs in public, or if you go to a big event, there's signs that say like, go this way, go that way, don't follow this way, go around. Our bodies and minds are built to be able to give us additional signs to identify when we're in distress, when we're navigating something that's not sustainable and to give us an alternate pathway to make a different decision. So some of the signs that I always recommend looking for, actually, the first step that I recommend folks do is to establish a baseline. Even if that baseline is under the influence of stress, so you already have a caregiving identity, that's already a stressor in your life. It also comes with some perks. Caregivers also have a really strong sense of self-esteem and can problem solve in different ways than the rest of us. So that's definitely a superpower. But when we think about establishing a baseline, how are you sleeping currently? How are you eating currently? What does it look like for you to be able to challenge or navigate a conflict with a coworker, with your spouse, or with a parent? Making a note of where you're at in a relatively calm space is a really good way so that you can notice differences when those things do arise. And what I'll say is that if you're noticing over or under eating, if you're noticing over or under sleeping, if you start to see sudden bouts of irritability or maybe even things like physical tension that your body, your jawline is very, very tight, your chest is very tight, your heart is beating fast, your breathing is shallow, all of those things relative to where your norm is can be really, really clear signals that it's time to get some additional support.
Absolutely. I'm so glad too that you highlighted it's those sudden changes as well because it can be really difficult. Like stress is stress. We all have
Yeah,
stress. We all have things that pop up in day-to-day life. But I always like to think about it as it's when it becomes more intrusive and
totally.
it's less, it becomes a lot less easy to navigate just kind of the regular bits and pieces of your day because of these things. And so, such a wonderful way, I think, to frame that. One of the things that I know that MHA does a ton of work on, and it's fantastic. But one of the things that can also, I think, bleed into a lot of the intersections that we're talking about is one word. And that one word is stigma.
Mm,
And it's here, I think, in this context of balancing work and caregiving and the mental health impact of that,
yeah.
how do you confront kind of the different pieces of stigma so that you can feel comfortable seeking out that support?
Absolutely, absolutely. My personal opinion on that is that the onus of that should not be on caregivers who are already navigating a difficult time, who are already under some form of distress because of the things that they have to do every day. You just mentioned that really beautiful example about getting a phone call when you're already in a work environment. And if you are just now preparing to get that type of phone call, my argument is that it's too late, that systems and interpersonal interactions really have to work to destigmatize these environments in advance. So if we're waiting for caregivers to take the responsibility of fixing stigma, that's backwards. Of course, we shouldn't do that, but we can expect our workplaces, different community environments, places, faith communities, things like that, to normalize the conversation around mental health, around caregiving, around these different aspects of our identity that may be able to cause disruption or distress so that there's a plan of action for everybody in advance, right? So that may look like ERGs or different wellness communities. It may look like financial assistance programs that are available for caregivers. What does the leave policy look like should an emergency come up? It's really, really important that these systems that we exist within, these communities that we exist within, have a clear support plan for caregivers and that it's communicated regularly. So, what that may look like is a supervisor who knows that they have a staff member who is in a caregiving capacity currently, and they might say, you know what? On the third staff meeting this month, we're going to review all of the different benefits that we have that are available to caregivers. Let's just do that in general for everybody's well-being so that everybody knows, what types of things are available. That takes the responsibility, the pressure, all of the extra tasks associated with that support off of the caregiver and ensures that everybody has an equal opportunity to access those benefits and make sure that there's something that can be utilized. Oh, you're muted, Nicole.
Thank you.
No problem.
No, I love what you said because I think it really tackles two different things. One is both that visibility and recognition, and how that in and of itself can lessen the impact of that stigma. It doesn't necessarily mean it goes away, but knowing that there may be other folks there, knowing that there's supports available, even if you may not know what they all include, can make that initial move a little bit easier. And I, of
Absolutely.
course, appreciate what you said about taking the onus off of the caregiving employee, and saying, we leadership, HR, and team leaders out in the workplace really can do a great service to those caregiving employees by doing some of that work to say, we're here for you. Um,
Absolutely.
we recognize what you're going through. Here's what we have. Get connected to this ERG. Find out about these financial support programs that we have. Make sure you know about our time off policy so that when you do have something that pops up, you're not feeling that burden.
Totally.
Um, and you're not feeling that, oh, now I have to reach out to my boss and let them know about this
Absolutely.
appointment.
So
I
many
love that.
workplaces see that when you signal to everyone, it's safe, it's okay. We have a plan for you if you have an emergency. We have a plan for you when we know that these are things that happen ongoing. So many workplaces see boosts in productivity. They see even more sense of calm in the workplace where folks aren't having to disrupt maybe urgent timelines for things because they've already been able to plan ahead and ensure that their schedule reflects the need to accommodate a crisis or an emergency or something that comes up. And so, when workplaces really create a culture of safety for caregivers, it ends up being a win-win for everyone.
Love that. And could not agree more. And I think that's really, I think, one of the heartbeats behind why we wanted to start the Caregiver Ready Workplaces initiative. So that's wonderful. So switching gears a little bit, and this kind of ties into what we've talked about earlier with, recognizing the red flags of just, okay, maybe things are piling up and maybe you need some additional help, or maybe some things are now necessitating some extra resources and support. When we talk about the complex emotions of it all, um, how how does a caregiver recognize when those feelings become um, necessary to seek that professional help?
Sure.
Um, that's something that we never want to negate when we talk about mental health supports, is that there are therapists and mental health professionals, that's their job. This is to support you and really give you a wealth of resources and supports. But how can a caregiver be able to say, okay, this feeling that I have, I'm okay. I don't need that additional, professional support versus, okay, I'm here now. This is
Yeah.
what I should do.
Absolutely. First and foremost, I would suggest that anybody who is in a caregiving capacity proactively seek out those supports by making lists or documenting the resources that are available to you somewhere. Because with such a high stress identity, it's really, really important to be able to have quick and easy access to the support that you need. Caregiver Action Network provides so many of those different resources and makes it very easy to access. But what's really, really important is to have them available because, as we all know, it's really much more difficult to make a decision, make the phone call, set up the appointment, do all of those different things when you're already in a place of distress compared to if you're able to maybe do some of the legwork on that sooner than later so that you can easily access them. But the most important thing, Nicole, about what you said is like, when is it time for sure to be able to access that professional help? And the metric that therapists use is more days than not, right? So if you think about a week, 5 days out of that week, you're having sudden bouts of anger, irritability, you're having difficulty sleeping, maybe you're over or under eating, you're noticing that muscle tension. It's really, really hard for you to just show up and do the things that normally come easy to you. That's happening more days than not. It's a good time to have a check-in with somebody to give you some additional support.
Fantastic. And that ties so well in with what we were saying. And I think even going back to some of the statistics that we talked about, where, caregivers were flagging 7 days
Yeah.
um, per month, saying these are probably not really great mental health days, and using that, I think, to start kind of monitoring, like you said, when you're starting to see that increase, when it becomes more imbalanced and it's more bad days than good, more struggles days than non. Um, Such an important piece of the conversation. Um, I think to kind of wrap up this piece of our chat here, I guess where can caregivers start? Where do you recommend that caregivers start in terms of finding these resources, finding screener tools that can maybe help them go to their healthcare professionals? That's another thing that we are always telling caregivers. Talk to your healthcare
Yeah.
team, your healthcare team, about your caregiving so that they can help you navigate some of those physical and mental health pieces as well. But what tools are out there that can help caregivers in those conversations?
Yeah, I would say first and foremost, caregivers do a really, really good job of prioritizing other folks. And I really love that you put the stress on your healthcare team, your support system, your community. I would say that for this sort of support to be most effective, it's really important to put it on the calendar. If you want to put 30 minutes on a Sunday afternoon just to be able to focus on yourself, check in with yourself, set those baselines, read some of the articles that we'll provide afterwards. That's a really good start, is to really shift the focus, even if it's just for a brief amount of time, from problem solving on the outside to problem solving on the inside. And one of the quickest ways to be able to do that, in my opinion, is the MHA screening program. So MHA offers a number of different screenings on all sorts of mental health topics like ADHD, trauma, anxiety, depression, all sorts of things. And most of the screeners take less than 10 minutes to take. And they're the exact same tools that you would get if you went to a therapist office or to your doctor's office and they were checking on some mental health symptoms. But it really puts the tools in your hands so that you can decide what you'd like to do next. Maybe that's a conversation with your health team, or maybe that's just something that you can kind of keep a temperature check on to see if you can notice changes. We mentioned that baseline before. Screening tools are a great way to set that baseline because you can say, okay, I took an anxiety screening a month ago and I was actually sleeping really well. But when I took it a second time a month later, my sleep had changed so much. It's probably a good time for me to check in with my doctor or my therapist or my support system. One of the great things about MHA screening program is that afterwards, you're actually directed to DIY tools as well. And so if you're not quite ready for a conversation with a licensed professional, you can utilize some of those tools to be able to support yourself in your mental health journey as well. The second resource I would recommend is mhanational.org/caregiving. So we actually have a caregivers hub where we feature some of the resources even from CAN. We have such a close partnership and resources and articles that we've developed as well to be able to support caregivers who are navigating mental health distress. So those two links are probably the most quick, easy, accessible ways that you can incorporate some self-care and learn a little bit more about your mental health next steps. And then, of course, CAN's resources as well. We definitely recommend that you visit their website and learn more about all of the groups and resources and different things that CAN has available.
Naya, thank you so much. You have been, I think, such a delight to chat with, and I have kind of been keeping an eye on the chat, and people are I think really sounding off and resonating with what you've kind of spoken to in terms of like noting when it's time to get that support, knowing where to turn, not letting that stigma get in the way of seeking that support. Um, I cannot thank you enough for sharing these resources, and just for speaking from your expertise and experience. This has been delightful. Um, what I'm going to do to kind of close this out here is I'm now going to walk through just kind of a summary of some of the things that we've talked about, hit on some of our resources, and we'll make sure that those resources are shared here in the chat and widely with you all so that you can access them as well. So, why don't we go ahead and bring the slide deck back up here? Okay. So I don't know if this is where we left off. Perfect. All right. So let's talk about some things that we can all do, some things that we've hit on that are great in terms of managing some of these mental health stressors in the workplace. So when complex emotions do pop up, and they will, the goal is to not suppress them. You want to be able to create um, enough space so that you can then find the help that you need. I think this really underscores some of the things that Naya was talking about. One of them is putting a name to the emotion, understanding what that emotion is, pausing, taking that step away and saying, I need just a few minutes to clear my head. I love how Naya phrased it, taking even a short amount of time to do that internal work instead of that external work, because we don't want to neglect that. And then resetting, um, being able to, I think, reset plus prioritize, finding ways that we can kind of pull all of these things together and work through them without feeling overwhelmed. Those are some ways that we can really, help mitigate those complex emotions, but also some of those stressors in the workplace. Next slide. Asking permission. So this is what we were talking about just a moment ago when discussing stigma and what we can do in the workplace when we need support. It can be very difficult. We can feel fearful about asking for that additional support, but it's really important to ask and get that support before a crisis occurs. Um, Prevention is always a great step, and so talking to that HR manager, or maybe it's the manager of your employee um, resource group, or benefits navigator, about what is available. Asking about flexible options. So things like leave, getting that guidance on how do I let folks know? How do I make sure that I am updating my calendar? What do I need to do so you don't find yourself, doing something that's going to make things more complicated? And you can do so by sharing only what's necessary. When we talk about disclosing your caregiving status, maybe with your team leader, your supervisor, your boss, you don't have to give every detail. It's enough so that they understand kind of the lay of the land. They understand what you're experiencing. and that helps them know how they can show up for you. Every caregiving situation is going to be unique, and how it presents at work is going to be unique. So sharing some of that is going to help your team show up for you. I think at home, and we talked about some of this, you know, make lists and make them concrete. Transportation, meals, coverage that you may need if you're going on a work trip or you have meetings that you can't get out of, paperwork, respite. Write down the support that you need, and share that. One of the things is that happens more time than not is that someone will ask, "Do you need help? Is there anything I can do to help you?" And I know that when I've been asked that question as a caregiver, I don't always have a response. And when you have that list ready, that can make it so much easier so that you don't find yourself, maybe an hour later or a few days later saying, "Oh man, I really wish I would have told, my neighbor that I really could have used some help picking up the kids from ball practice because I needed to pick mom up from, dialysis." Um, Assigning one next task instead of trying to explain everything. I'm one of these people that loves a whole picture and loves to work in that whole picture, but sometimes breaking it down, making it in those bite-sized chunks so that you can kind of move through things quicker and you're not getting wrapped up in maybe some of the details that aren't as pressing at the moment, can make things go a little bit smoother and put less stress on you. So those are just some of the things that can be really, really helpful in naming and getting the support that you need. Next slide. So let's talk to HR leaders. Let's talk to team leaders. How can those folks in the workplace reduce some of that strain and the pain points that we've talked about? Well, one thing that we stressed, I think, a couple of times here is recognition. So normalizing caregiving as a workplace reality. So saying, "Hey, we know that employees are balancing work and caregiving because there's a lot of caregivers out there." Um, and the person that might be sitting next to you may be a caregiver as well. You may just not know. So normalizing caregiving in that workplace is another way that you can minimize I think, the stigma. Train those managers to respond without overreaching. So again, protecting privacy. Um, we That's always key. We don't want folks to feel like they're put on the spot and having to divulge so much about maybe their loved one's condition or things personal to them that may not be necessary. So, training managers to be able to provide supports and be there, be responsive without, um, you know, creating that environment where you feel like you're divulging too much or avoiding that judgment, um, connecting those caregivers with leave and the flexibility, those employee assistance programs. We kind of interchange the terminology of employee assistance programs and employee resource groups, but um, and benefits navigation. We talked about that at the beginning as well. Excuse me. Um, and then auditing who can realistically use the support, review access for these supports so that you can make sure that those who are using it have the easiest time getting to it. Feels pretty simple. Next slide. Knowing when more help is needed, we talked about this. Knowing when those emotions get to be too much. Naya phrased it perfectly. More bad days than good. Knowing when it's interfering with your day-to-day life. Changes in sleep, your appetite, your energy, um, excuse me, all sorts of those things can be a sign of those impacts. And here, I want to point out that we have put in the lifeline number. Um, we always want to make sure to meet caregivers where they are, especially in those needs, in those times of crisis. So you can text on 988 or visit 988lifeline.org in those crisis moments where you may have thoughts of self harm um, and maybe in immediate danger. Next slide. So going back to reducing hidden strain, let's talk about some resources. Well, our toolbox, the CAN Family Caregiver Toolbox. This is really a hub for many of our resources. So if we've named it and it's a CAN resource, you're going to find it in our CAN toolbox. And one of the great things is that you can search through it in lots of different ways. In fact, you can even search through it by indicating that you're a working caregiver, and it's going to populate with kind of these curated resources that speak specifically to balancing work and caregiving. Uh, the Caregiver National Help Desk, the National Caregiver Help Desk, rather. This is really kind of what it sounds like, but it's also so much more. It's like a support line for family caregivers. It's not an emergency line like what we just talked about, or a crisis line. But it is a place where you can reach out and get connected to a caregiver advocate, a caregiver expert, someone that will listen and connect you to resources and that support lines that you may need. Very, very, very important resource that we have here at CAN. They can also connect you to resources, for example, the ones that we've shared from Mental Health America, and even some of those local resources. So I know that we've put the link for the help desk in the chat if you want to find out more about how you can get connected there. You can subscribe to our newsletter. Take care to find out more about the resources that we're launching. We're always launching new resources. And so if you want to stay in the latest news, that's always a good place to be. And then, of course, within there, I guess kind of in that same vein, those resources that we share, um, HR leaders, share those with team leaders, share those with the employees that come into your office, those new employees. Nothing that we have in our toolbox is something that you can't make part of, something that you share with an employee who may be looking for some additional supports. So, those are kind of the CAN resources that I wanted to hit on. Next slide. And so, a couple of things that I do want to also name is kind of going a little bit more in depth here. The Mental Health America Caregiver Hub, as Naya called out, they have a whole section of resources dedicated to caregiving. And so we'll put a link to that. And also CAN's Caregiver Ready Workplace Hub. You guys are here. You're part of the hub. This is really where we're leveraging all of our resources for those caregivers that are balancing work and caregiving, as well as those HR and team leaders. We also will give a call out to NAMI, another one of our mental health partners who has a stigma-free employer guide. This is a really great resource and definitely something, again, that can be really beneficial to those employers and HR professionals in the workplace. Next slide. So, I think to kind of wrap things up, uh, not to get more, I think, in the weeds with numbers, but Our friends at MHA have reported that 79% of caregiver screeners showed moderate to severe symptoms. And NAMI has noted that 47% of caregivers reported increased anxiety, depression, or related concerns. So, what does that boil down to? Well, naming what is happening as a caregiver, naming those support needs, naming the pain points is a strength and it's not a failure. Asking earlier is prevention, and it can help keep isolation and burnout at bay. For those HR leaders, benefits can only be beneficial when folks know about them, when they have access, and they are trusted. And so, making sure that these are in the hands of folks, I think is really, really key. And for the organization, if you are leading an organization, a workplace, a caregiver ready culture is really, really key. So we do, in addition to the resources that I have named here, we do have a number of resources that are specific to emotions. Um, Talking about some of those complex emotions, compassion fatigue, the importance of emotional wellness, coping strategies, the whole shebang. Again, these are part of our toolbox. I just wanted to call out that, again, there really is a wealth of information there. Next slide. The mental health screener tool. This was something that MHA and NIAS spoke about. So just wanted to give you a little bit of a glimpse of what it looks like. And such an amazing tool. You can also access it via our mental health resources as well. We've kind of built it into many of our mental health resources so you can get plugged in there as well. And again, you can see that it is pretty robust in what it may be able to help you know and address in terms of different pain points across your mental health journey. Next slide. All right. And so these are just going to be slides that hit on some of the resources that we've already talked about. Next slide. The caregiver toolbox, again, really great visual here to show you that you can search through the toolbox in lots of different ways and get access to everything that we have available. Next slide. The help desk. Not only does this give you the number, so you can jot this down real quick, but it also shows you that you can access the app now. This was something that we launched in November of last year, kind of coinciding with National Family Caregivers Month. Really, really great way to bulk up different resources. Next slide. And our newsletter, of course. Make sure that you're subscribed to kind of be in on the most recent news from Caregiver Action Network. We also include headlines that are, I think, really relevant to caregivers, caregiving in the news. I think that's a really important piece of what we are able to share in our Take Care newsletter as well. So make sure that you have subscribed. Next slide. And here's how you can be in touch. If you have any questions and want to reach out to us, please do so. info@caregiveraction.org. We do check that email address. I know some people get a little bit leery about an info@ email address, but we do check it. You can call. There's that number for the caregiver help desk, as well as all of our socials. Even though we are in the very end of May, Mental Health Awareness Month. November is right around the corner, and it is going to be National Family Caregivers Month, and we are very, very active on our socials. We share stories. We do this year round, but we get really, really excited around National Family Caregivers Month. So make sure that you're following us. This is also where we share stories. We share resources, both resources that we have created, as well as resources from our friends at Mental Health America and all of our different partners across the landscape. So, thank you all so much for spending this time. I know that we threw a lot at you, but I think our conversation was amazing. And we were really able to highlight, you know, not only what some of those pain points may be for caregivers that are balancing, uh, the workplace stress plus caregiving stress, but some resources and tools to help you take those next steps to get the support that you need. So, thank you all so much for being here. And we hope to see you for our next Benchmarks of Care presentation. Thank you, Naya.
Thanks, everyone.